Well, David Ashford, the Minister for Health, Social Care and everything is here. You're going to spend a lot of money on this, aren't you? I mean, this is not going to be cheap. What, up to £750,000 on a report?
It is money well spent, Paul. In relation to the health review, it's something that should have been done quite a long time ago as far as I'm concerned. Both the Department of Health and Social Care and Treasury have been working in partnership to ensure that we can deliver this. I think we've got a huge opportunity here to really develop a national health service that is fit for the 21st century, to have proper integrated care that other jurisdictions have struggled to deliver, and deliver something unique.
You're working in a silo. I think even you or Alf Cannon use that word still, that this awful thing that, I mean, silos can mean all sorts of things, but the fact that change is never liked, never sort of helped along, you've got resistance. Do you think this is going to make a change that and unblock things?
A lot of the professionals working in the health service that I've spoken to have realised that things just can't continue as they are. And there is a real commitment from within the Department of Health to ensure that this works. We want to engage and we want to make sure that what comes out the other end of this delivers a proper health service for the people of the island, because that's what we're talking about. The health service is something that at some point we all come into contact with, and we mustn't forget the service users at the end of it.
You're passing the buck though, aren't you, by bringing somebody else in? I mean, you can't make these decisions yourself then?
Not at all. The problem is Sir Jonathan is an expert in his field. You've interviewed him before, you've seen the sheer breadth of knowledge that he has, and also he's someone with a record of delivery. And that really matters. And I think sometimes when you're too close to things, it's better to bring someone in from outside to look at it and say, give an independent point of view. And in relation to the health service, there's been a lot of firefighting going on. I said that on the day that I became minister. And sometimes when you're busy firefighting, you haven't got time to step back and look at things strategically. And that's what we need now. We need someone who can step back, take a breath, look at the way that things are working and interacting. And you referred to silos there. And within the NHS, it's very important that the different areas of the service do interact with one another, that they do communicate, that they do complement one another. Okay. And at the moment, I'll be frank, as Minister, I don't feel that is happening. And I think that this review gives us an opportunity to deliver that, to ensure that we have a proper integrated service.
Okay, let's forget about this for a second. Let's talk about your job. What's going wrong? What's happening?
Well, again, I think it's been mainly down to day-to-day firefighting. The people have been so busy having to focus to keep the services that they are involved in working as they should and actually delivering their own day-to-day job, that they haven't had time to stand back and do the transformational things.
Down yet? Are you okay?
I'm absolutely fine. I mean, anyone viewing this, I think will see I've still got a smile on my face, and that's always a good thing.
Poison chalice?
I said this to you on my very first interview as Minister. I don't believe it's a poison chalice at all. I think we have unique opportunities. I said that as well. 2 months in, I still stand by that.
Back to this then. He comes up with something. Let's say it's you should charge everyone to go to the doctors. If you don't believe that, would you still put it forward, or would that be the sort of thing that gets annihilated before it comes as a public document? I'm being kind of,
no.
Do you get to move things around before it goes
Sir Jonathan has full editorial rights over the report. We have asked for a proper independent review. This isn't one that's going to get rewritten after the fact, Paul.
Oh, you mean like some have been then?
No, I didn't say that. No. And you're not going to leave me into saying that either.
I was being mischievous.
You're always being mischievous.
Thank you.
But this is a proper independent review. Yeah. Sir Jonathan has full editorial rights,
let's say
and that will be what comes forward.
Let's say he does say charge to go to the doctors. And then you still got to put it to Tynwald, right? I mean, what he says doesn't actually go through. So it could still be, everything can be bumped on, and nothing can change if you don't get the will behind you of men and women of Tynwald.
I really feel within my colleagues there is a will to get things moving. People want a proper health service design that's fit for the 21st century. I said in Tynwald on Tuesday that what I want to see is an NHS looking forward to 2048, not looking back to 1948. This year, in July, we celebrate 70 years of the NHS. And I mean celebrate because it is a unique healthcare system.
I think I asked you at the time, but you're in the job 2 days. How do you feel about charging for services now you've had a few months in the job? Do you feel it's something it will be happening, or will you be looking at it, or what?
Well, it's one of the things that will have to be looked at. But again, this
so that's
isn't...
not a no then, is it?
Paul, if I start ruling things out here and now and rule out everything, eventually, what's the point of having a review because you're ruling that out?
I just trying to find out what we need to do and what you're thinking.
What we need to do is have a proper holistic review, and that means looking at everything. But that doesn't mean all this scaremongering that's gone round in recent months about people talking about the NHS is going to get privatised. Absolute nonsense. I've got to say. We got approved at Tynwald this week the 7 fundamental core principles of the NHS, and that is now the policy of Tynwald.
Well, we'll meet again on this subject in January, and then in May for the final.
We will indeed.
And see what is all happening then. But you're relaxed.
Indeed. Yes, and like I say, I'm looking forward to an NHS fit for 2048, not looking back to 1948.